guys, what's up, what's up? I'm back, it's Bree, and it's time for another video. As you can tell by the title, starting my back to school series. Yes, you wanted it, so it's here. Back to nursing school. First video is going to be the what's in my bag video. Haven't touched this stuff since last semester. Giving you guys some ideas as to what you need in your bag for nursing school. So I'm really excited. Hope you guys are excited. School's about to start, so let's get into it. You guys, I have my bag here. Please don't judge me in this bag today. Please don't judge me in this bag today. I'm giving y'all the real deal, the real situation. I'm a pretty neat person, but this bag, we're just gonna see. Okay. So first off, my bag, this is the bag they gave us at orientation at my school. It just has our logo on the front of it and nothing on the back. It's just purple and it's just a good size, sturdy bag. Has a zipper on the top and has this holder for our name tags, but you know, papers fall out, so I don't even know what they were thinking with that. But okay, so the first thing I see in here is my clipboard. For clinicals, they always told us to bring a clipboard. This is only because we don't have tables in the room that we sit in where we actually like take our notes and stuff. So they wanted us to have something to write on, which is cool. It's pretty necessary. It's pretty necessary. I don't think that you're gonna be walking down the halls with this. Like, it's literally, at least for my school. This is all just my experience, you guys. At my school and at most people's schools that I've seen, we don't get to take stuff in the hallway because of HIPAA. So we can't have people's information just flying down the hallway. So you have to keep it in a sectioned off area. Anyways, so this is my clipboard. I just got it from Walmart. It's just a blue one. And I wrote my name at the bottom, and it just opens up. I still have some papers in here. Like I told y'all from last semester, I have not touched this stuff. I was like, done. Some stuff from, not from clinicals, but like some stuff we did on campus last semester. So that's my clipboard. The second thing, oh my gosh, I have here is my stethoscope. This is a Lippmann Classic 3. The only reason I got the 3 is because I really wanted this color. If you can see, it's like copper right here. It's copper right there, and it's also copper on the bottom here. And then it's just brown. So I think it's called chocolate and copper, but it was only available in the Lippmann Classic 3. And when I saw it, I was like, I have to have it. So there's a bell side and there's the diaphragm side. And this side also comes with the diaphragm piece, but you just take it off because they don't really need you to use it. Use both sides. We're not doing babies. This is like the baby side. So yeah, we use it as a bell instead. So I have a couple books in here. We have to take 2 books with us at all times for clinicals. Our drug book, which is this one, which is the Mosby's Drug Guide for Nursing Students. You see I got all my tabs in here. I'm organized, y'all. I'm organized. And then the second thing is our diagnostic and laboratory test reference. And I don't have anything in here. I didn't really use this a lot, actually. I used to just look it up on the computer. But, or I knew it. I knew most of it's like for normal ranges. So like when you have a patient and you have to look at their labs, like you need to know what a normal potassium is and a normal calcium, all those things. So that's what this is for. Just knowing the normals of everything, so that you're not like writing down something that's not true. I keep my ID in here also. I went ahead and just got 2 IDs because we have to have an ID at all times. So that way, if I forget the one that I have at home, I always have one in my bag just in case. And that was the one that had the scanners for our meds. So I just left that in my bag so that I would always have it. This is a gait belt. Also, I just want to say that most of the stuff that I have, my school gave to me. I bought the stethoscope. It was about 120, I think, because I got it engraved. It has my name on it and SFA on it. So, but most of these kind of tools, I'm going to tell you, but this was given to us by our school as well at orientation along with the bag. So this is our gait belt. I've never used this actually before, except for when we were trying it out on each other. So I've never actually used this in a hospital setting. Let me say it like that. But yeah, it's my gait belt. You'll figure out what that means when you get to nursing school. I have some lotion, just some Jergens. Oh my goodness. Some Jergens Ultra Healing Lotion just for my hands, because you wash your hands a lot because everything is disgusting and dirty and it's a hospital. So then your hands get dry and then you need that. I have a lot of alcohol swabs in here, which also they gave to us. Didn't spend any money on most of this stuff except for like to pay for classes. But yeah, this is what I wipe my stethoscope off with. Anything that I have during the day at the clinical site, I'll just wipe it off with alcohol swab afterwards. Even my watch. I don't wear this watch. This is my Fitbit. I wear another watch. So yeah. This right here is my blood pressure cuff. Oh, I was like, where is the zipper? I thought I had broke it. This is the one that they gave to us once again, with the rest of our stuff. It's just blue. We actually don't ever use these either. At the hospitals, you know, they have the electronic machines now, so we use those a lot of the times, but sometimes when they want us to practice, we just use the hospital ones because, once again, germs, nasty. You don't want to transfer those germs to other patients as well. So these are like our personal ones for like practice. I practice on my friends with these. I have a lot of, what are they called? Telemetry. The telemetry monitor. Everybody on our floor that we had clinicals at had a telemetry. So I just one day got a whole bunch and threw them in my bag. So this is another bag of stuff that they kind of gave to us so that we would have supplies. This is a pen light. It actually works. Wow. So, yeah, and it just has the pupil sizes on the side. Yeah, so they ran out, like, immediately. Like, I don't think I had used it yet on the old batteries, and they just sucked. So I had to get some new batteries, but it works now. Yay. These are things you kind of want to keep in your pockets when you go to clinical, like the pen light, your lotion. These are tweezers. These are not scissors. And I've never used these before. But that's why they're in here, because I've never used them before. We also have a tape measure. I'm pretty sure is what this is. Yes, a tape measure. Still in the packaging. So, haven't used that before either. Haven't even touched it at clinical. This is like the reflex hammer. And we used this, but we didn't use it in the clinical site. We used it for assessment. Like, we just, you know, when we were assessing each other, we used this. My journal that I kept everything in, I thought it would be in here, but I don't know where it is. I have this little cute Mickey Mouse journal. You can use any, like, small journal that will fit in your pocket. I have all of my stories in there, so I really hope I didn't lose it, because I had some really interesting stories, you guys. If you want to hear some stories, comment down below. I won't give anybody's information, so I won't be violating HIPAA. I have tape that I pretty much took from the hospital. I mean, I just took a roll because I was using it so much. Whenever people have their IV in, and they need to take a shower, you need to wrap it up with, like, something. So I used a trash bag, and I always had to tape it and then untape it, and that was like all of my patients. Here's my ID badge. It just says Brianna, nursing student. I have a lot of pens in here. I have the actual scissors that you need to carry around during clinicals. These need to be in your pocket because, once again, whenever you have to wrap people's arms or anything, scissors are your best friend. And then I have tongue depressors and cotton tipped applicators, which we used only in the assessment setting with other classmates. I think that's it, you guys. There's a lot of trash down here. Oh, and my thermometer, which once again, we didn't use these. We used the ones at the hospital, the electronic version. But they did give us a thermometer when we went to orientation, and these are the ones that we used in like assessment and then like for practice, like with my friends. So yes. And that's it. I hope you guys loved this video. I was really excited to film it. So comment down below if you want to hear some of my nursing school, my clinical stories from last year, my first year, my first semester. So let me know down below, and then like this video if you like this video, and subscribe, and see you guys in the next video of this series.